So, welcome everyone after the lunch. And today we have with us Dr. Kersi Chavda. Honestly, he doesn't require any introduction as most of us know him so well. I feel so privileged today to introduce him as he has been my teacher also when I was in Prafulta. He has been past president of Bombay Psychiatric Society and currently consultant at PD Hinduja National, Hinduja Healthcare, and Sir H.N. Reliance Hospitals. He had been chairperson of task force of the Indian Psychiatric Society dealing with school psychiatry and counseling. He has been on multiple panels and played vital role in repealing Section 377. Dr. Chavda is working more than past 35 years with keen interest in kids psychiatry. He had been part of the first panel of the Maharashtra government that had laid down concession for learning disabilities in Mumbai. And he's here with us today to talk about important part of child development, and that is how to prevent and deal with depression in parents. So, sir, thank you so much for being with us today. And now we can start.
Yes. Thank you, Priya. It's an absolute privilege to be here. Sometimes as professionals, we kind of forget that people who have special needs children need to be dealt with themselves. So when you're a parent and you have a special needs child, very often there are certain things that happen that make you feel that life may not be fair, that make you feel scared, anxious, and very often you land up yourself having a whole bunch of problems which are not really looked after. I must have been a consultant to about 7 or 8 schools dealing with special children. I was with the SNP University Special Ed Department. I have worked with spastics. I have worked with a whole bunch of people. And over a period of time, there comes a stage where you realize that maybe the parents of special needs children deserve an award. I think it's absolutely incredible the kind of work they do. And it's absolutely incredible the kind of work that they continue to do. Like I said, very often we don't pay too much attention to their needs. We're looking at how they should deal with their special needs kids. If the kid is angry, what do you do? If the kid is depressed, what do you do? I was just listening on before the lunch break about the pediatrician who spoke about issues related to the autism spectrum disorder. I'm going to be talking about something that's fairly specific. Now, we all know that depression is the commonest psychological disorder, psychiatric disorder. And nowadays, we no longer speak about it in terms of silos that you're only depressed or you're only anxious. By and large, it's merging. So we don't really talk about a person just in terms of his depression. Very often, a large percentage of people who are depressed will have some anxiety, and people who are anxious will certainly have some elements of depression as well. Next, please. So the bottom line is nobody gets married in order to get divorced. Nobody delivers a child expecting a child with special needs. And it's a big thing when that does happen. A whole bunch of people, when I talk to the parents, they say that initially it's an absolute fearsome thing, because you've just maybe interacted with a few kids who had special needs, or you've seen things on television or in films, which certainly may not be what they would actually get in actual reality. So this is how it starts. Next, please. For parents having a special needs child, it may increase stress. Now, stress is a general encompassing term which is used over and over again, and it doesn't really mean anything. But we look at it in terms of the fact that you have this equilibrium. Parents are in a state of equilibrium. All of us are in a state of equilibrium. And suddenly there's an excess stress, some stimulus that kind of topples you over the edge. So your hemostasis that you were used to being in no longer remains, and you'll end up crying, or you'll end up getting very angry, or you'll end up feeling very sad. Whatever it is, there is a kind of an increase, and you no longer are in that state of hemostasis. Affect. It certainly is going to affect decisions about work, education, and training. A lot of people get married by the time they're about 27, 28, sometimes even younger. Some people are still pregnant. I mean, some people are pregnant when they're still studying. And very often then, when you have a special needs child, a lot of decisions that you make related to work and education and training gets changed, because then you have to take in the special needs child and his or her needs into account as well. Not surprisingly, it will take a toll on mental and physical health. And very often, it makes them rethink about having additional children. And I was going through the program, and I think tomorrow somebody is going to be speaking about the second child, which is an extremely important issue related to this. But I'm not going to speak about it because it's a full topic in itself. Next, please. Can there be any positives, or is it only negative? Over a period of time, one finds it does broaden horizons. You learn a lot that you had no idea about. It certainly does increase family cohesion. Now, unfortunately, it can work both ways. Sometimes it works and you get works negatively, and you can land up getting separation in your family. Father says, I don't want the child. Mother says, I don't want the child. And sometimes that becomes a problem, and you have schisms and separation. But very often, especially if there is a supportive environment, we find that there is an increase in family cohesion. It makes families aware of their own inner strengths. It is absolutely incredible what families find themselves capable of doing, which they would have had no idea about if they did not have a special needs child in their midst. And it certainly increases connections to community groups. This is one thing I'm going to be harping about. We need to ask for help. And one of the most important issues in all of this is community support. Sometimes we get into this, what do people say? How can I ask for help? Will I be imposing on them? And that is all nonsense. We need to ask for help, and we need to ask for help, and we need to ask for help. So connections to community groups becomes an extremely important aspect in this, which in a sense adds to positivity. Next, please. However, what we often see is that there's an increase in guilt and blame, especially if one parent is blamed for having a special needs child. I told you to stop drinking, but you would still occasionally have that glass of wine. I told you that you should not be working just till before you delivered. You don't listen to me. Things like that. If that happens, then you get this guilt and blame thing, which certainly is supposed to be avoided. Initially, almost everybody will have a reduction in self-esteem. Is there something wrong with me? Is there something wrong in us? Have we done something? Could we not have done something? Am I a bad person? Is that why it's happened to me? Etc., etc. And it diverts attention from other aspects of family functioning. Sometimes we forget that a family has things to do besides bringing up kids. You have to look after finances, you have to look after the house, if there are older people, you have to take care of them, you need to look after yourselves. When you have a special needs child, very often attention from all of this is diverted, and the focus then becomes the special needs child. And it certainly causes repercussions for relationships with other family members. There's no two ways about that. Very often we find that the so-called normal child feels left out unless he's made part of the process of helping the special needs child. And over again, I have parents coming to me with the normal, so-called normal child, and the normal child says, my parents just don't give a damn about me. All they bother about is this fellow because he's got fits, or because he shouts and screams, or because he misbehaves, or because he can't smell, or he can't spell. And I have been left in a corner, and I'm supposed to do whatever I can do. Nobody gives a damn. We also have to face up to the fact that costs matter. Speech therapy, physiotherapy, occupational therapy, medication, psychiatry, all of these do cost. And yes, concessions are available, municipal hospitals are available, general hospitals are available, insurance is now available, but it's still an extremely expensive process. So very often certain things, certain expenditures are put on hold, and the money is then channelized more into dealing with the needs of the special child. Next, please. Studies show that infants with a serious health problem actually cause parents to have an increased likelihood in either divorcing or living apart. And that's a very sad thing, because this is the time when you would actually expect that the parents should kind of get together and be more supportive of each other. But we find that there's an increase in divorce. We have found that in such a situation, it's almost taken for granted that mom should not work outside the house. India is changing. A lot of ladies are in extremely important positions. But if you have a special child, it's almost taken for granted that you will have to give up your very exalted position and look after the special child, at least initially. It is almost taken for granted that dad will not be able to deal with the child as well as mom. This attitude is also changing, but it's still very much there. There's no question about the fact that there is decreased social participation. If I go to a party and I have a special child and I look around me and I see the other kids with so-called normal kids, and the kids are running around and talking and laughing, they're managing to follow instructions, they're managing to do things one after the other sequentially. And I'm looking at my child and she's struggling to get up to a particular place, and very few people can understand what she talks, and maybe she pushes somebody and maybe she doesn't listen, and maybe there's a temper tantrum. Not surprisingly, then there is an enormous amount of social withdrawal, at least initially. And parents have said over and over again that it becomes very embarrassing initially, especially if the child has temper tantrums or gets very aggressive or just doesn't listen and has severe oppositional behaviors. It also gets extremely difficult when you have people coming over home, because very often with the excitement, the child will end up doing things which might be inappropriate or which might even frighten the other person. Even though the child doesn't intend to, people can get frightened. Not surprisingly, then they'll end up really reducing social activities. And peer activities are reduced also for siblings of kids with illnesses. It becomes difficult for a child who's so-called normal to take a special needs child, especially if there is a severe behavioral issue, and go and play in the garden or go to his friend's house, especially if their ages are not very far apart. There are a lot of kids who manage very well, but there are a lot of kids who would prefer not to, and that can have their own problems related to it. Next, please. For parents of kids with developmental disabilities, studies have shown that both mom and dad show increased evidence of depression and anxiety. And these obviously need to be addressed. Sometimes, like I said right in the beginning, we really don't pay so much attention to that. And I think that attitude has to change. Next, please. Not surprisingly, again, the kind of issues that parents face obviously will get aggravated when there are obvious behavioral issues such as increased aggression. If the parent has a child who's well behaved, who might have issues, but who's comparatively well behaved, who's constantly smiling, who seems to enjoy being touched and hugged and kissed, who looks and behaves cute, your heart still breaks, but you love what you see. When there are increased aggression, when there is increased aggression, when there are temper tantrums, when there is destruction of property, when other parents keep coming and complaining, that becomes a major issue. So then, not surprisingly, the health of the parents deteriorates further. The other thing which we don't pay so much attention to, and which we should pay a lot of attention to, is when the special needs child has a problem with sleep. We must remember that adults need sleep just as much as kids do. The adult has to look after the house, has to do a whole bunch of other things through the day. We all survive once in a while with lack of sleep. But if day in and day out, because the child doesn't have a proper sleep pattern, there are issues relating to his sleep. And because of that, a parent has to stay up over and over and over again, day after day, day after day. That's going to cause an aggravation of the parent's mental and physical state. Next, please. Mums. Most often, mums are the ones who have to deal with most of the problems. Things again are changing. There are a lot of, I have been very pleasantly surprised to find a lot of stay-at-home dads while mom actually goes out to work. And that is a new trend that is happening, which is wonderful. Because today we no longer speak of mothering and fathering, we speak of parenting. But by and large, still. I remember a mom telling me, when people see me crying, they think I'm having a bad day. I'm not having a bad day. I just feel that there is no hope for the future. I have a feeling of failure when I recognize that the child is not developing the way he or she should. And we are all optimistic and we all hope that the kid will do better and better and better. But over a period of time, it gets it. And then when I cry, I'm told, be strong, be brave. Next, please. There is the pain of taking the kid to a therapist when they should be out playing with friends. No parent likes to take a kid to a therapist. None of us like to go to doctors. Why should a parent enjoy taking a child to a doctor or a therapist? It causes an issue. It is frustrating when you have to go on and on and on teaching activities of daily living. It becomes very problematic. It becomes very aggravating. It becomes very irritating if I have to teach the same thing over and over and over again. And a lot of kids with no problems also need to be taught a particular thing over and over again before it becomes easy for them. But very often for these kids, you need to do much, much more. And finally, I feel ashamed of myself and I feel envious of my friends who do not have kids with special needs. I'm very happy for them, but I feel envious and I get into this. But why me? What wrong have I done? Why could I not have had somebody who didn't need so much of extra care from my side? And then I feel guilty about it and I feel ashamed about it. And I tell myself, there's something wrong with you. How can you even think like that? That is actually considered to be normal. Next, please. It is isolating. I've already talked about the isolation that you feel. Eventually, you almost land up always only interacting with other parents who have other special need kids, which is not good for you and certainly not good for the child. And then very often I feel beaten down by the system. I mean, all said and done, just because of the incredible amount of pressure on the system, people may not be able to be as nice, and professionals may not be able to be as nice and gentle and caring and understanding as you would like them to be. And then sometimes when you are having a bad day and those guys snap at you, it becomes a problem. So the mom was saying that I really feel beaten down by the system and then I feel hopeless, because when I start thinking that if the system cannot give me a problem, then that becomes an issue. Next, please. But society expects me to be positive, upbeat, and encouraging, which makes me feel worse. So I'm supposed to constantly smile. I'm supposed to constantly walk around like I own the world. I'm supposed to be positive and optimistic. I'm not supposed to show off what I actually am feeling from within, and that actually makes me feel worse than me. Next, please. So we'll end up getting depressed. And I'm not really going to go into medical aspects of depression, but you should know this. Breastfed enough and things like that. But today we know that it is all related to genetics. So genes shape brain structure and function. Genes do that. And it's very, very important in depression. We also have brain structure and function where there is abnormal connectivity between neurons. There's abnormal neurotransmitter functioning. There's abnormal circuit connectivity between various brain regions, leading to abnormal emotional processing. And when you have this abnormal emotional processing, that's when you'll end up having depression. Environmental situations can trigger off depression in an already compromised individual. So you're managing, you're coping, and then there's a little bit of extra stress and you'll end up getting depressed. Genes are present in every cell of the body so that the effects of depression are not limited only to abnormal low mood and negative thoughts, but all body systems are affected. Hence, you'll end up eating too much, eating too little, running to the toilet, having chest pains, because all the systems are affected. So what we saw with Sanjay Dutt and his chemical locha is just one little part of what we all now know makes up depression. Next, please. What happens then when a parent lands up knowing that he has a child with special needs? Usually there's a variety of emotional stages. So you land up feeling disbelief. There is often anger and guilt. There's very often rejection, and that makes you feel even more guilty. There's often shame. I've done something wrong. What will people say? I'm the bad person. And there's a feeling of helplessness. And this helplessness is really the stage where we as professionals and parents and support groups, which I'll be talking about later, need to be aware of. We do not want people to feel this helplessness because it's not at all useful. Next, please. There are often periods of indifference and anger, depression, apathy, and bitterness. There's often a feeling of loneliness. And hence, like I've said before, it's easier to relate to the parents of another special need child, which again aggravates the feelings of isolation. Now, when I was in school, whenever we opened our books, we started off by saying man is a social animal. It still holds good. And somehow this social animal bit, which is so very important for all of us, no longer seems to be existing. And that is why it is so very important for us to be aware of the fact that isolation has to be fought by all parents. Next, please. Fact. We must know that parents of special needs kids will invariably resent their child at some point. It is going to happen. It's normal. So don't feel terrible about it. The moods of the parents will also suffer because home demands and home environments are extremely demanding. And then what happens is that we'll end up getting angry with people who don't really deserve it. So you're driving home and you're already in a bad mood, and somebody comes in front of you and you pull down the window and you scream and you abuse, which you would not normally do. And you know it's a kind of venting. And they are going to feel more tired and drained. Almost universally, the tiredness and the lethargy and the feeling of absolute lassitude is an emotional component. Of course, we do rule out anemias and other issues, but it is an emotional component and has to be dealt with psychiatrically. Next, please. Sometimes we talk about romance and they say, what the hell is romance? Who has the time for it? I'm so exhausted and so is my husband that we just get into bed after dealing with our child who's screaming and shouting and needs our attention. And even before our head hits the pillow, I go to sleep. So romance goes out of the window. You do find out, however, who your real friends are. And almost invariably, all the parents who come to me with special need kids talk very, very fondly of about 3 or 4 or 6 people who are always there. They say that when we need a time out, they're there. When I want help, he's there. When I want somebody to go to the grocers and pick up something for me, when I can't go myself, they're available. And that makes the difference. Multitasking causes confusion and apparent memory issues. This is something that we've seen quite often with people who are very stressed most of the time. They have a lot of memory issues. And then they come up to me and they say, do you think I'm going into early dementia? Is there something wrong with me? Should I get a CT scan done? This, that, and the other? No, you don't. There's just so much happening in your head that it becomes like an obstacle and the normal imprinting does not occur. So it's absolutely essential for us to be aware of the fact that these are normal situations. Next, please. Mums almost invariably, like I've already said, face more stress and experience more pressure because they spend more time with the special needs kids and they look after the other aspects of the house. Now, we do have dads also who do the cooking and dads who might do other stuff. But by and large, in most households, mom is the pivot around which the house works. So not only has she have to look after the house more or less, she also has to do the other stuff. Not surprisingly, mom is getting tremendously drained and very stressed. Next, please. There is too much pressure in our culture to pretend that parenting is a total pleasure and that good parents love each other and love every minute of it. And this adds to the stress of parents of a special needs kids. I mean, I have a son, and there have been so often times when I wanted to beat him up, and I adore him, I love him, I do anything for him. But there are times when I can't stand the guy. That's normal. But when you go into this culture of, oh, how can a parent say that? You must love the child, it's great, and so on and so forth, and I must love every minute of it. You don't love every minute of it. You don't love your spouse every minute. You don't love your own parents every minute. So let's get real. Yes, we will do everything that we need to do to ensure that the child is safe and to ensure that we can do the best that we can for the kid. But it's absolutely okay at times not to enjoy what you're doing. Next, please. So nice to talk about everything that happens. Now, what are we going to do? I think probably the most important thing is to make a list and to have a provision of the needed psychosocial, educational, and health services which are essential. When I had started practice about 35 years ago, very little was available. Today, there's an enormous amount that's available. There's an enormous amount in all fields. There are educational services which are available, learning disabilities, which I was so fortunate and privileged to have started in the sense we started it only for the 9th and the 10th. And today you have it from standard 1 and it goes up to IIT. Provisions which are available, which the parents have taken over. You have now services for the spastic kids. You have reservations for a whole bunch of things. Now we're talking of integrated schools where you have normal, so-called normal kids with so-called kids with special needs. It helps both. So we have to make a list of this and we have to keep pushing and keep pushing and keep pushing. You can't sit on your laurels. We have to do whatever we can in order to help this, because this is something that will strengthen family coping. Eventually, parents are going to feel good if they can see that there is something happening for the needs of the child. So we need to have this systematized as much as possible. Next, please. What do we mean when we say coping? So when we say coping, it's actually the cognitive and behavioral effort made to get rid of demands that have overwhelmed or weakened a person's resources. Sorry, there's a spelling there. So the important thing is we have to do whatever we can intelligently and behaviorally to do the best in order to strengthen our own resources, in order to strengthen ours and in order to strengthen the kids. And if we are strong as parents, then the kids are going to get much more help from us than if we kind of crack up. Next, please. And in this comes resilience. So we got to be resilient. Everybody talks of resilience, but it's actually our ability to cope in the face of adversity. And this is certainly something which is not the best thing in the world, trauma or stress. So we begin to learn this in childhood. We already are resilient in our own selves. I mean, we're all dealing with the COVID fairly well right now, but these are some top tips where we teach the child how to become resilient. So whether you have a kid with special needs or you have a kid who doesn't have special needs, some of these are useful. And I have found these very useful even for parents, and I suggest them to parents to be used as well. So remember, bad feelings don't last. They don't last forever. Nobody's going to feel bad for the rest of his life. Nobody's going to feel good for the rest of his life. Try to normalize setbacks and see that it's usual to have difficulties, and by and large problems can be resolved to a large extent. Encourage young kids to keep things in perspective. The problem is usually confined to only one part of their lives. This is specific for kids, for normal siblings of kids who have special needs. When you kind of tell them that the special needs is a part of your brother, it's not the whole brother. When you're looking at your brother, you don't only see X, Y, and Z. You're seeing a kid who has these problems. Let's deal with the other part of the kid. Humor and laughing. I think that's probably the most important thing. But of course, it has to be well-intentioned. It can't be sarcastic. It can't be nasty. We delegate as much as possible. And when you delegate, you're teaching kids responsibility. And that responsibility over a period of time is very, very beneficial. That happens even for adults. So if mommy is doing all the stuff, then please delegate to the other people in the family. When reading stories or discussing events, point out how people manage to overcome difficulties. This is very useful for kids. Why are we doing all this? We're doing all this so that our kids actualize their potential and they do the best that they can do, given their limitations and given their handicaps. There is nothing that makes parents feel as proud, as happy, as when they see what they thought was a previously unteachable person blossoming and doing fantastic stuff. And that is what we see. We have to remember that learning is frustrating. I mean, we all had frustrations when we were learning, but we have to also kind of push them and believe that they can get there. And I think parents are the best guides for this. The stuff that you guys can do to your kids in order to get them to achieve levels is incredible. Provide support and create a positive environment as much as possible where you emphasize the importance of relationships. Once again, connections are extremely important. It's very difficult to work in isolation. Next, please. So when we talk of parental stress, we need to allow and we need to push and we need to do the best that we can to have him integrate ultimately within society. So we're going to teach him the best that we can do in order to get him to be well. We're going to teach him resilience. We're going to use all the supports that are available already in society, and we're going to use legal recourse where is necessary. Once again, if I come back to the to the special needs things for SLDs, parents went to court and they got a whole bunch of concessions because courts, by and large, are quite sympathetic to this. For the LGBT, we managed to get repealing of Section 377. Finally, sometimes a legal perspective might be necessary, and we've got to fight for that. Next, please. There is an importance of the social support systems, and in this, role of grandparents is a must. Now, by and large, grandparents are lovely people. Most of the parents who I have been dealing with who have special kids, most of them have utilized their grandparents incredibly. I have so many case histories where the grandparents have kind of taken over and become a special educator, become a special teacher, become a speech therapist, taken over the upbringing of the special needs child. They're fantastic. My point is, a lot of us have grandparents, have our own parents, but we don't take the help that would make a difference. It is essential for us to ask for help. And a lot of people ask me, but won't it look bad? No, it won't look bad. And please have the faith and the trust, not only in grandparents, but in other people, that if they wanted to say no, they have the right to say no. So if somebody asked me for help and it was not possible for me to provide the help, I would say no. But if it is possible, I will say yes. So give me the right to decide, which means ask for help. Do not become Superman, do not become Superwoman. Next, please. We need to have time for ourselves. This is probably the one thing which reduces stress and anxiety and depression in people. Whether it's when you have a special child or whether you have other issues, have time for yourself. And we have this whole guilt thing of how can I keep time for myself? What will people say? They'll say I'm selfish. They'll say that this is not the way it should be done. They'll say it's this and they'll say that. And finally, they don't give themselves the time. It is imperative that we also look after ourselves. Let's face it, the parents are going to be the guys who are really going to be the main caregivers by and large for the child. We have to look after ourselves. It's not going to end. Our caring is not going to end in a year or 2 years or in 3 years. It's going to last for a very long time period. In that time period, if we start giving ourselves also that importance, we're going to find that our stressing out, our anger, our irritation, our depression, occasionally our suicide feelings will reduce. If our entire life is only fixated on doing stuff for the special needs kids, it's not what we would advise. So I'm actually telling people who are obsessed with and I call it obsession, obsessed with looking after their child to the best of their ability so that the whole day out, that's all they're doing. Stop doing it. Find time for yourself. The world will not end. Your kids are not going to have major problems if you take that 1 hour when maybe you're watching a Pakistani serial or you're doing a Zumba dance or you're just sitting and reading a stupid novel which nobody else wants you to read. You need to do that for yourself. Next, please. Counseling, therapy, everybody talks about it. Counseling is useful when you go to a person who shows you a different way of looking at what you're experiencing and gives you a different perspective. So my kid does this, I'll end up responding like this. The counselor might suggest there are other ways of dealing with it. Can you think of another way which is less frustrating to you and more beneficial to the child? Very often therapy is needed when you start having major issues relating to the way you feel, the emotions you're experiencing, and things like that. India is considered to be an extremely religious country, and there's a lot of spirituality. There are a huge number of parents with special kids who utilize religion as a form of dealing with their problems, and that's wonderful. It becomes counterproductive if that's the only thing you do. If your child has special needs, and the only thing you do is you take him to a priest or you take him to a religious head who prays over him, and that is being, shall we say, not very useful. And you need to allow for the professionals also to get in and do whatever they have to do for the child. Eventually, like I keep saying, utilize everything that helps you, but be sensible in terms of professionals. Next, please. We need to help parents feel more capable and effective in caring for their special needs. And this is one of the things that is known to reduce the risk of depression. So it's not that the child has to become better, though that is, of course, a big bonus. It is the parents have to feel capable and effective in caring for them. And that's where therapy comes in. That's where professionalism comes in. And that is why we talk of a multi-pronged system where the speech therapist will tell the parent about what to do, and maybe the occupational therapist will do that, and the psychiatrist may or may not give medication and things like that. When you feel more in control, when you feel you're doing something effective, and hopefully you see the changes in what you see in the kid as he grows up, that's when risks of depression and anxiety actually start to reduce. Next, please. We talk of self-help and supportive groups. There is nothing as effective as this. When I was working, just after I had done my post-graduation, I had started working in a special school, and a very small special school. And in that, we started a self-help group where we would meet once a month. And it went on for about 15 years. It was only parents and teachers. And the amount I learned in that was incredible. The amount of support parents could give each other was incredible. The amount of confidence that each of them built for each other was absolutely incredible. And now research has shown that self-help groups, supportive groups, whatever you might call it, and basically maybe just moderated by a professional, but very often even that is not indicated. This seems to be the most effective thing, one of the most effective things in reducing stress in people, in reducing stress in parents, and reducing their anxiety as well. So this is something that I would support and I would encourage to the utmost. When you learn from other parents as to how they have coped with the kind of behaviors that maybe your special kids have, that is what will make a difference to your lives. Next, please. And then medication. When I started with my postgrad and I started private practice, there were not too many parents who would come and talk to me about medication for themselves. Today, there's a huge number of parents who come to me and talk about it. They have problems with sleep, they have problems with appetite, they lose their temper a lot, they feel depressed, very often they are very, very anxious and they get panic attacks, they have stomach aches, the whole gamut. At times, medication is necessary. We need to realize that special needs parenting is exhausting and is draining. And if the only way, I mean, not the only way, I mean, don't speak about it derogatory, but if one of the ways of preventing that from happening is to take medication, then take medication. If you're a special needs parent and you have a headache, you'll take a Crocin or a Combiflam or something. If you've got acidity, you'll take an antacid. If you have evidence of anxiety and depression, and that's affecting you and not allowing you to function at the level that you should, please take the help of somebody who's a psychiatrist like me and take the medication that is necessary for as long as it's necessary. You owe it to yourself and you owe it to your family, and you especially owe it to your special needs kids to prevent this from happening, where you'll end up getting burnt out and depressed and sad, and that's not going to help anybody. Next, please. And here I'm going to talk about dear Dr. Google. Now, Dr. Google's not a doctor. He's about 18 years old. We've been doctors since longer. Don't pay too much attention to him. I mean, if you otherwise type in a vitamin, you'll find that you're either going to die or going to get cancer. So let's stop looking at Dr. Google too much. Let's not pay too much of attention to him. And there are these myths of medication also, in terms of I'm going to become a zombie, I'm going to sleep the whole day, I'm going to eat the whole day, I'm going to come under somebody else's control, I'm going to become a different person. All of that is nonsense. Those are just myths which are not based on reality. Please go to a person who's a qualified guy and who would help you cope with whatever else has happened. The most important issues related to anxiety and depression is in terms of preventing it from happening as much as possible. Yes, we know that there are stresses associated with bringing up kids who have special needs. And probably the biggest stress is that you don't see it being time bound. You don't say that after 5 years it will go away, after 10 years it will go away. In some cases it does, but very often it doesn't. Given that, it's essential for us as parents to be as strong and circumspect and confident and motivated as we possibly can be, but to accept that there may be times when we are down, and there may be times when we are very anxious, and there may be times when we get angry and do things, and then we're very ashamed and we say, oh my God, why did I do this? So you did this because you're human. You did this because there was a genetic tendency which made you maybe more depressed and more anxious than other people who don't have the genetic tendency. Given the fact that about 20 to 25% of the population is going to have some kind of psychiatric illness sometime in their lives, when you have stresses similar to maybe continually dealing with kids with problems, those stresses are going to be paramount in your life. So whether you deal with it with counseling, whether you have a good lifestyle where you incorporate a little bit of physical activity, you don't drink too much, you certainly don't smoke, and you don't do drugs. You have a good set of friends with whom you can laugh and fool around and joke. You look at your own child and you don't see only the special needs part of the child, but you see a child who's a lovely kid. And I'm sure all our kids are lovely. We give ourselves a little bit of time where we do our own things. We take medication, or we take counseling, or we take therapy as much as possible. We ask for the help of people around us. Can we ask for the help of our parents and our grandparents and our siblings? Then life will not be as bad as otherwise it could be. Next one. Thank you. 45 minutes. I was told it's 45 minutes. Please take over, Priya.
Yes, sure. It was an amazing session, sir. So we discussed many things during this 45 hours. We discussed about no one gets married to get divorced, and no one ever thinks that they will deliver a child who has with a special needs. I just love this thing, because every parent sometime or the other, they think about better thing, and when they start that union, when they decide to be together, when they get married, when they plan a child, they always think for a better things. But when they start knowing about about the child is having some dysfunctions, the child needs some extra care, that time that phase becomes very shocking for them, and very they goes in that traumatic thing, how to help the child now, and what will be the child's future. So there is a lot of uncertainty, lot of stress they face, and definitely it's a painful thing what they are going through. Then you discussed about the parent having special needs. In them, the stress level increases a lot. It affects, it somewhere start affecting their emotions. And, when they plan for an additional child, one more child, then they have a lot of uncertainty, a lot of confusion, whether to go for it or not. what will happen if I have another child, and even that child will be having special needs. So they have that kind of stress in them. Then you started discussing about positivity, and you said that parents needs to go ahead and ask for help. It is very much required. In special parents, there is a lot of guilt, a lot of reducing in self-esteem. Then it start affecting their family functioning. Their whole perspective, whole schema gets changed, and basically the joy, the happiness, it's they leave everything behind, and they just get their day-to-day routine becomes extremely monotonous. They start going away from society, social functioning, attending many things. They start it's somewhere, it is a stigma also. They have stigma like how I will take my child outside, how people will think about everything, whether people will accept my child or not. So they go through with a lot of social stigma as well. When they face a lot of behavioral issues, definitely it increase in their aggression level. It is at a point, it is very disappointing and disheartening when the parents are aware, when they know, when they are aware my child is not going to develop the way he or she should. Then we discussed about how overall they feel, how environment is going to take care of the child's development, how the society is going to accept my child or not. And in that, they start going into the isolation. They start develop that feeling of hopelessness, that despair. How I would able to tackle everything at a point. You discussed very well about romance goes out of the window. Absolutely true. Because even I have seen so many parents, the romance, their emotional connectivity, their bonding between each other, it start affecting so much. And what I feel is that when we talk about stress, when we talk about depression, in fact, it start increasing more when you have lack of close relationships. And especially when you do not have supportive spouse, then it start affecting more. Then we started talking about prevention, or what parents can do when they're suffering from so much of emotional instability. Then first and foremost thing is, they can ask for help. They can ask for social, psychosocial educational services, health services. They can ask help from there. They need to work on their coping mechanism. They need to build their resilience, asking help, sharing duties. They can create a bonding. There are many people I have seen, they have migrated from some other place to Mumbai, or uh, and so they do not have that family connected to them. Many a times it's like nuclear families, and that time they feel extremely lonely. You happen to discuss about grandparents and all. Yes, few families, they definitely ask help from their grandparents and other family members. But there are parents I have seen, like they have migrated to some other, shifted to other cities, and there absolutely no help they get. So here I would insist, parent supportive group they can create. They can make new friends, and they do not have to hesitate basically for asking help. Once they will start asking, definitely people will be there to help them out. And connectivity is very, very important. Close connections are very, very important. Then importance of social support we discussed, and it is creates a wonderful thing, like it gives them somewhere a feeling of support. It gives them somewhere the feeling of there is somebody with me, I'm not alone. So social support is very important. You definitely talked about counseling and therapies, could be the helpful thing for the parents. Then in India, being in India, we all are so much religious, we follow certain spirituality. It becomes helpful at a time for to come out of that emotional trauma. uh, we discussed about medication. Here I would I'll be definitely asking a question, because there are so many of myths. So many parents I know, they are suffering a lot, but still they are not ready to ask for help. they hesitate for medication. I don't know what they feel. They feel maybe they, as you mentioned correctly, they will be having a lot of withdrawal. They will be having a lot of drowsiness. It will start affecting their overall cognitive functioning. And that is the reason somewhere they go away from medication part. So here definitely I'll be asking for like guidance. I'll ask question accordingly. And as you mentioned correctly, stay away from Google. Dr. Google. See, being a psychologist, when I had my, delivery and I delivered a premature child, that time it was so much of fear, so much of anxiety because my child was admitted into NICU and for many days he was there. So me myself, being a professional, suffered a lot through that anxiety. So I know every time I was like Googling out on some certain information about his health. And so I can very well understand, I can definitely get connected to moms, and especially it is done by moms. Dr. Google is especially close to all the moms. So definitely, thank you so much. You discussed that part. Staying away from Dr. Google is very important. And basically, we have to see the beauty of the child. And most of the time, we just happen to see that my child is having special needs. My child is different. More than that, we need to shift our perspective. And we just need to enjoy that beauty of the child, that innocence, that, that connectivity, that non-verbal communications. As a parent, I think they need to somewhere focus on all these things a lot. So thank you so much, Dr. Chavda. Now, I would like to ask you a few questions on behalf of parents. The first question was from one mom, and she's asking, what about single moms who has to manage everything, emotions and finance and health and everything on her own? And how she can manage herself not to go for depression?
Yeah, I mean, there's no simple answer to this. Obviously, I'm just going to give generalities. Every case will be dealt with separately and specifically. Single moms will have more of a problem than if you are having a spouse who was supporting you. There's no getting away from the fact that just discussing issues with your spouse would make a lot of difference, which would not happen if you were a single mom. Try to get a good friend to be a help. Try to be somebody who you can, try to have somebody who you can talk to. If there is nobody available, just seek the help of a counselor, and let the counselor then over a period of time become a friend. There is no simple solution to what you're saying. Yes, at times, especially if you also have to look after the finances and look after the house and look after the child, and you're staying all alone and there's no real support, it's going to be a tough life. In such a situation, also be realistic and then seek crash services or whatever else it is. Let us just be as realistic as possible and as practical as possible.
Thank you so much, doctor. There is one more question. Senior citizens with special need children who are in middle age, already feel depressed consequent to this pandemic. There is child also exhibit depression in these times. Thus, the stress levels are very high. How does one cope with that?
Yeah. There is no getting away from the fact that as a person becomes older, the parent is also going to become older. And if over a period of time that special needs child can become independent, that's wonderful. If he cannot become independent, let us again be practical and realistic and work out what you're going to do after you're no longer there. Let us be sensible and work out things. There are certain places which have been started now for special needs kids, something like a commune, something like a sheltered place to stay in, like a sheltered hostel, and more are needed. More and more are being started. You've spoken specifically about the pandemic. There's no getting away from the fact that this pandemic has increased the amount of depression and anxiety that we find in just about everybody, because over a period of time, people just hate being alone. They can't go out. They constantly have to wear masks. They're hearing horrible things about horrible things happening to people who they care for. They're seeing these terrible visuals on television. So my suggestion is, in general, yes, you have to know what's happening in the world, but don't get obsessed by the news. Watch it for not more than about 15-20 minutes a day, or maybe twice a day. Try to spend as much time as you can in doing physical activity. If your kid or you already have been seeing a doctor, be in touch with that doctor much more than before the pandemic. And if something has to be adjusted in terms of medication or adjusted in terms of counseling, then please get that done. I might also say that during the pandemic, the cops have become very, very sensitized towards special children. I have been very pleasantly surprised to find that. And I would say that if at times you need special permissions and things like that, especially when there's a lockdown, the cops today, by and large, are very, very helpful and supportive. So take all the help in the world that you can.
So there is one more question I was tried asking you before also, that there is a lot of myths regarding psychiatric meditation. Sometimes parents are not sure, like, when to go for it. So
okay.
what could be the threshold?
There's no such thing as a threshold, but basically let's look at it like this. Supposing you had a fracture in your legs and you would normally seek the help of a orthopedic surgeon. You wouldn't go to a physiotherapist. You'd be stupid if you went to a physiotherapist. Supposing you had a heart problem. You're not going to go to a yoga therapist, even though we have people who say that yoga can prevent heart attacks and all of that, which may be true. If you landed up having a major problem with your cardiac status, you would go to a cardiologist, you would not go to a yoga therapist. So when you have a problem where you start saying that maybe the kid is sleeping too much or sleeping too little, eating too much or eating too little, becoming very aggressive, having evidence of hyperactivity, becoming very anxious, having panic attacks, seeming to cry all the time, talking of suicide, etc., etc., it would be necessary then to seek the help of somebody like me. And then we talk of medication. Medicines, I've already spoken about depression. And just like that, we have biological constructs for every kind of psychiatric illness that there is. Yes, medicines can cause side effects, but if you're looking at the benefits in comparison to the side effects, the benefits are much, much more. I've had so many, if you're looking at, say, for example, attention deficit disorder and hyperactivity, the previous speaker had spoken a little bit about it, affects about 12 to 15% of the population. And I have so many kids on it and so many parents who initially are very scared to put their kids on it. And then they wait 1 year, 2 years, then they put the kids on it and then they come back in about 6 months saying, we really wish we had taken your advice in the past. If there are side effects, we deal with the side effects. But by and large, the beneficial effects overcome the side effects to such a large extent that it would be stupid not to use it. Now, just incidentally, a lot of antidepressants or a lot of psychometric medication are very beneficial in cancers. They're very beneficial in COVID situations. They're beneficial very much in cardiac situations. Half the gastroenterologists use psychometric medication. 3/4 of neurologists use psychometric medication. And you're not aware of it just because the guy you're going to is not a psychiatrist. So often people come up to me and say, oh, we're so scared of coming to you. And I go through the medicines that they're already on. And I say, 2 of these medicines are what I would have prescribed. And they say, Arey, but we went to another doctor.
Yes.
So that is something that we should be aware of.
Yeah.
Point number 2. How long do we continue with it? The usual rule of thumb is first episode, depression or anxiety or whatever, you give it for a period of about 9 months at least to a year after stability. Then when you taper off and you stop, about 70% or 80% will not have a problem in the future. 20 or 30% might. It increases, the possibility you have a relapse increases if there's a bad family history, too many stressors, economic status, educational status, etc., etc. In which case you might need to continue with it for a very, very long time. And now this becomes another problem. Supposing you are taking antihypertensives for your blood pressure, you take it for the rest of your life. If you are having diabetes and you tried everything else, but finally you were put on insulin or you were put on anti-diabetics, you take it for the rest of your life. You have a thyroid problem, you take a thyroxine or an entoxin or something like that before breakfast for the rest of your life. And you wouldn't go to the doctor and say, oh, my pressure's under control, can I stop the medication? You wouldn't do that. Somehow, taking my medication causes a lot of problems. And I say, why? They say because it affects the head. Well, guess what? Most antihypertensives work through the brain. A lot of anti-diabetics work through the brain. The thyroid certainly has release factors which work through the brain, but nobody bothers about that. People are only bothered about psychiatric medication. Get over it. Stop acting like a nitwit. The other thing also is, let's not get into this thing of log bolte hai ki kuch hoga. Who are the log? I don't know, but the log are there. Who are these log? And I've asked hundreds of people, but nobody knows who these logs are, but these logs are there. So let's find these log and ask them what the basis of their philosophy is, because we haven't yet found out who these log are.
Yes. So thank you so much, sir. After a long time, I'm hearing so much of knowledge from you, and I feel so happy to be part of this thing. And thank you so much. Now I would like to hand over to Dr. Somil Ashar. He will be the moderator for the next session. Thank you so much, Kersi, sir.
Thank you. It's been an absolute pleasure. Thank you guys for inviting me. I can see your faces suddenly. So bye-bye.
Thank you,
Thank you so much, Dr. Kersi. Thank you so much.
Thank you so much, sir.